All right. Can you all see the screen? All right, perfect. We're up. So when we talk about our pelvic floor, we have to remember that the pelvic floor is a part of a system. It's part of our core system. We're all so involved with our core and how sexy it looks and how firm it is or how flabby it is, whatever you want to think of. But it truly is part of a system. So let's start. Here's our little anatomy skeleton. Here's our skeleton, right? We've got our face, we've got our trunk and our rib cage, we've got our pelvis, our thigh bones, our arm bones. So we're looking at one half. So we have the first layer under our skin, right behind the fleshiness, whether there's lots of adipose tissue or fluffiness there, or whether there's a little, our abs are there. We have our external obliques. I'm going to hide them as we go. Then we have our six-pack muscles. Can we see that? Next to the six-pack is the linea alba. That's what connects the six-pack, one side of the rectus abdominis, to the other side. This is the space that splits, if you will, or has a separation, as many people know to be a diastasis recti or a diastasis recti. So we'll take that out, take out the rectus abdominis. Then we have our internal obliques. See how they wrap all the way around to the back of our pelvis? And then we have our transverse abdominals. So our true core is made up of 4 basic components. Our transverse abdominals, which wrap around. If we had another left side, we would see that here. I'm going to hide that for the moment. Our diaphragm, which is under our rib cage, divides our lungs from the rest of our anatomy, and our stomach, which is our breathing muscle. Then we have small little muscles that are along the back called the multifidus or rotatorius muscles. And then we have our deep pelvic floor muscles. The pelvic floor muscles are not shown here. I have a better picture. But that's truly what makes up the core. So as we move on to our pelvic floor muscles, I'm going to show you the ones that are deeply connect to the rest of the core, including the diaphragm, the transverse abdomen, and the multifidus. So if we look from the back, here's our tailbone. We've got our piriformis muscles. A lot of people know that muscle to be the muscle you stretch when you're doing pigeon pose or figure 4 stretch, or like other people call them like a runner's stretch, some people will do. That's not a pelvic floor muscle. However, it's very close. The pelvic floor muscles are deep inside the pelvis, here we are, and go from our tailbone to our pubic bones in the front and to our small little sit bones. So that was the inside view. Now I'll show you the outside. Tailbone, and then to sit bones, and then to pubic bone. So it kind of makes up this deep basin or a deep hammock. The pelvic floor muscles, as I was saying before, help to give us support to our body. They help to give our organ structure. They give us stabilization for our back and pelvis and hips. They give us our sexual appreciation. And as I said too, they also give us a little bit of sump pump action, if you will, or a little compression and release for the musculature, for the veins and the arteries in the area to kind of move the blood flow and lymphatic tissue. So as a PT, you can see that there's lots of things to check when you go to pelvic floor physical therapy. Pelvic floor physical therapy looks different for many people, depending on what you're dealing with, whether it's urinary incontinence or constipation or pelvic pain with maybe a gynecology exam or even intercourse. Or let's say you have some scar tissue after having a baby, or you've had a cesarean delivery and you have a large scar across the lower abdomen and you're having trouble recruiting your abdominal wall. A physical therapist specialized in pelvic floor physical therapy, or even pregnancy or women's health physical therapy you might hear, can specifically address and assess that musculature. And by putting it all together as a system, you'll have the best outcome.